A coronavirus is a virus that infects several different species of animals, one of them being people, humans. There are 5 or 6 known coronaviruses that get people sick. They're actually very common. The common cold is caused by a coronavirus. The coronavirus that's coming out of China that we're seeing right now is what they call a zoonotic virus. A zoonotic virus is a virus that originated in another species and it had moved into, in this case, man. This particular virus, they believe, originated from a live animal market there in Wuhan, China, and had transferred into people and is causing this disease. There's been a couple different theories as far as what species it came from. Originally, it was thought that it originated in snakes. However, now, a lot of the DNA sequencing that they have done is implying that it came from bats. There's a very strong similarity between coronaviruses and bats and the coronavirus that we're seeing that originated there from China. To prevent catching this disease is just simple procedures that you would do to prevent catching any sort of bacterial or viral disease, which is, if you have to sneeze, sneeze into your elbow in your shirt, sneeze into a napkin or Kleenex, blow your nose in a Kleenex, wash your hands after touching different surfaces. I know now in the stores, and I've noticed a lot of people use it, is when they grab their buggy, they'll take the wipes and wipe it down. A lot of it is just good personal hygiene to prevent not only catching the disease, but spreading the disease or any kind of disease besides this one that we're talking about today. People that are planning to travel internationally should go to the CDC's website and look for any sort of travel restrictions that may be, or recommendations that may be in place by them, but also the State Department. They would have actual restrictions that have been put into place.
Here's 3 things you can do in the face of coronavirus. 1. If you know anyone who's old or infirm, avoid face-to-face contact. Check in with them remotely, so call, Skype, email, or text. I'm checking in with my local geriatric right now.
Absolutely not.
2. Don't be a prick. Buying 20 bottles of hand sanitizer makes it harder for other people who may need it more to get just one. And it kind of defeats the purpose if everyone else is germy apart from you. Makes it more likely that you're gonna get it. Washing your hands more regularly might chap your knuckles, but it could save a stranger's life. And also you can moisturize your animal. And I can 100% absolutely guarantee you that your life will be none the poorer for missing a Stereophonics gig. In fact, there are no circumstances in which I would advise going to a Stereophonics gig, but the point still remains. Avoid big crowds. Bangladeshis queuing at Ambala, I'm looking at you. 3. Join your local mutual aid group. Go to covidmutualaid.org or follow @COVIDAidUK on Twitter to find out how you can practically and safely support vulnerable people in your neighbourhood. Thousands of people from across the country have already signed up, and let's be real, Love is Blind isn't even that good anyway. Self-isolation doesn't just mean abandoning the most vulnerable people in society. If we can, we must look out for one another. Come here, mate.
As the coronavirus spreads across the US, nobody knows how many people will be infected. But judging from prior pandemics, some experts suggest that between 20 and 60% of adults will contract the virus. Not everyone who gets infected is tested or shows symptoms. Harvard's models estimate that on average, about 1/5 of those infected would have symptoms that require hospitalization. ProPublica reviewed new data from the Harvard Global Health Institute to map several scenarios for how this pandemic could play out. The colors show the hospital beds available in each region, starting with green, where hospitals would be less than 100% full, to red, where at least twice as many hospital beds would be required than are currently available. This assumes that hospitals don't free up already occupied beds. Even in one of the best case scenarios, where the virus spreads over 12 months and the infection rate is 20%, many regions of the country would be at or above their existing hospital bed capacity. Some regions would struggle more than others to handle surges of patients. One place is Seattle, the region that had the nation's first virus-related deaths. Typically, about 71% of Seattle's hospital beds are occupied, leaving less than a third of their beds open for additional patients. If 20% of adults become infected within 6 months, the region would need more than double its total beds. If the virus spreads more slowly, over 12 or 18 months, the pressure for additional hospital beds eases. But if the infection rate in Seattle is 40%, the need for beds goes up dramatically. And if it's 60% over 6 months, Seattle would need about 5 times as many hospital beds. If the virus spreads faster and a greater percentage of people are infected, bed shortages would be more dire. If 20% of the country is infected over 6 months, most regions would need more hospital beds than are currently available. Hospitals would be forced to either expand capacity, limit elective surgeries and unnecessary treatments, or even make life and death decisions about rationing care. In the worst case scenario, with a 60% infection rate in just 6 months, the nation would require more than 7 times the number of hospital beds that it currently has available. That's why slowing the spread over a longer period of time is critical. Experts say if we adopt social distancing strategies, like staying home and avoiding crowds, we can slow the spread, so hospital staff can be better prepared to treat patients in the coming months.
The spread of the coronavirus in the European Union challenges our health systems. We need to protect our health workers who are in the first line of defense against the virus. We must safeguard them with protective equipment, masks, gloves, protective garments, etc. We work on 3 fronts. First, we are working with the industry to ramp up production. Second, we need to keep in the EU the protective equipment that we need. This is why we adopted today an export authorization scheme for protective equipment. This means that such medical goods can only be exported to non-EU countries with the explicit authorization of the EU governments. This is the right thing to do because we need that equipment for our healthcare systems. Third, we need to share that equipment in the European Union. National bans on selling protective equipment to other member states are not good. We need to help each other. No country can produce on its own what it needs. Today it is Italy that rapidly needs large quantities of medical goods, but in a few weeks other countries will need it too. By producing more, keeping it in the European Union and sharing with each other, we can protect our health workers, patients, and contain the spread of the virus. This is why I propose this European solution today. Also, we need to keep goods flowing across Europe without obstacles. Just imagine, as we increase production of medical equipment, factories cannot get the components they need in time. Thousands of bus and truck drivers are stranded at internal borders on parking lots, creating more health risks and disrupting our supply chains. If we do not take action now, shops will start facing difficulties in refilling their stocks of certain products coming from elsewhere in the single market. In this moment of crisis, it is of utmost importance to keep our internal market going. In general, measures taken at national level can only be effective if they are coordinated with neighboring countries, in particular in border regions. The European Commission is working around the clock with the national governments on all these fronts. Tomorrow, we will launch joint public procurement with member states for testing kits and respiratory ventilators. These are badly needed for our patients across Europe. Also tomorrow, we will present guidelines to national governments on border measures. Protecting people's health should not block goods and essential stuff from reaching patients, health systems, factories and shops. We will be successful if we work together and rapidly on a coordinated response. The challenge we face requires it.